Welcome everyone. I'm Dr. Perkins, a board certified OBGYN, and today we're talking about, can fibroids cause nausea during pregnancy? And so we'll discuss a little bit today about what exactly are fibroids. We'll talk about how these fibroids could cause nausea. We'll talk about management strategies and things that you can do to help to reduce the risk or the likelihood of having nausea during pregnancy that is being caused by your fibroids. And then I'll kind of talk to you about when you should worry about the impact these fibroids are having on your pregnancy. So let's first talk about fibroids. What are they? They're benign growths. They're non-cancerous growths 98% of the time that may develop somewhere in your uterus. When we think about where they're located, while endometriosis could be anywhere in your system, fibroids are really kind of located right here in your pelvis. This is an image of your uterus here. Fibroids can be located on the inside part. It can be in the muscular area. Fibroids can literally sit on top of your uterus and hang off like a fruit on a tree. Okay, and they can be all different types of sizes. And so because of that, we know that fibroids can have different impacts on your system. If they are inside of your uterus, they can cause more bleeding and it can increase the likelihood of miscarrying. If it is inside of your muscle, it can lead to having heavier bleeding issues or problems with your contractions when you're laboring. If it is hanging off of your uterus, we know that it can push on your other organs inside of your abdomen. You have your bowels, you have your stomach and your pancreas and your liver. And so depending on the size of your fibroid, it can really cause problems for you. Now, I recently had a patient who she just had her baby and she did not know she had fibroids. She showed up to the hospital with a lot of nausea and a lot of vomiting. And she's just like, listen, doc, I can't hold anything down. Not water, not juice, not a cracker, not a piece of meat. It is not happening. And at that time, she was in her early second trimester. And so we did an ultrasound and I was taken aback at how big her fibroids were. Mind this, she was not a big person. She was actually quite thin, like 5'2", 5'3", and just not very heavy. And I'm like, your ultrasound showed that you have a 16-centimeter fibroid. Do you know how big a 16-centimeter fibroid is? Huge. Think of a baby's head being about 10. 16 is about a size and a half of a baby's head. And actually, she had 3 fibroids, all over 10 centimeters. And just to make a long story short, she just had no room in her abdomen for her bowels to move, for her stomach to expand, to hold food. She had no space because of these fibroids. And so what happened was she's now delivered and had a baby, but her pregnancy was severely impacted with nausea. She had all the meds and steroids, all the things that we could have given her, and she was actually admitted until the point of her delivery because we needed to even give her nutrients through her IV because her stomach couldn't hold any food or very little food. And so I share this story to say that, yes, fibroids could cause nausea during pregnancy. And a lot of that is going to be dependent on the size as well as the location. If you have blueberry-sized fibroids, the likelihood is that you're not going to have a lot of nausea because of the fibroid. But if you have sizable, really large fibroids, they can absolutely affect the nausea that you're experiencing. Now, that's talking about the fibroids, but we know that pregnancy in and of itself causes nausea, right? So if you're just like, listen, I have a lot of nausea and I know that I have fibroids, could it be that? Could be. But are you in your first trimester? Are you in the time frame that we know that HCG, the pregnancy hormone, is just super high in your system, and we know that it causes your muscles in your body to relax, including your stomach, and the likelihood of you having nausea and vomiting is much higher, especially with morning sickness? Or are you in your second trimester and your nausea has improved but is still just lingering, which again can happen because you're still having the pregnancy hormones and your body may still be sensitive to that. So you may still have a little lingering nausea, but is it severe enough to the point where you're losing weight in your second trimester? Is it to the point where you are unable to hold anything down, not even water? Is it to the point that you're weak and you're unable to walk and move and go through your daily activities? Is it to the point where you're having electrolyte abnormalities, where you need IV hydration and IV support? And so if you're experiencing these things, it could be because of a hormone or the pregnancy. If you have large fibroids, it could be that as well. Or it could be another underlying condition that's happening that requires evaluation by your doctors and possibly being at the hospital for further treatment. Now, if you're just like, yes, we've done all the testing and we've checked everything and I'm still just having all this nausea, sometimes we may have to go to the extremes and kind of look at things on a bigger picture. Fibroids, even though they may be smaller, we know that they can systematically impact how your body functions. We know that fibroids, especially if they start to degenerate, can actually change the way your immune system works. We know that they may release different things into your body that can impact how your stomach and your intestines respond. And so indirectly, even though they may be smaller, we know that they can influence the amount of nausea that you're having. And so in general, what do you do? The first thing that you want to do is you discuss the symptoms that you're having with your doctor from the beginning. We want to keep track of what your symptoms are like over time. Are you again in your first trimester? Are you in your second trimester and things have gotten better, but it's just not all the way gone? Are you in your second trimester and it's worsening? Are you in your third trimester where in your third trimester your uterus has grown quite a bit and now your baby and the uterus is pressing against all your organs? That is a different kind of nausea that can happen. And this is now not necessarily because of the fibroid directly, but because of the growing uterus. The space is no longer there for your stomach and your bowels to move as they should. And so nausea can return in the third trimester because of that. But talking with your doctor will eliminate all the different causes, or at least will stimulate your doctor to evaluate further, to look to see why it is that you're having this nausea during pregnancy. All in all, there are so many different things that we can do. Like the patient that I mentioned initially, she had medications like Reglan and Zofran to help with the nausea. She had steroids to help with that nausea as well, which really significantly helped. And so there are things that can be done. You don't have to suffer. And so if you're having this trouble or this problem, please talk with a doctor so that we can help you. Now, I hope this information has been helpful today. I hope that you've learned a bit. I hope that if you are experiencing this, that things in life will get easier and better for you. And you know what? I think there's another video that might just be so helpful for you today that will help you on your journey with fibroids. So click the link in the description of this video and follow me over to that other video and let's learn. Let's continue on this journey together. I'm Dr. Perkins. Thank you so much for being here.